So Asian
Yes, I
ladies
would
don't
say.
really drink, don't really smoke, quite quiet at home.
Not really. Asian, I would say we have a thicker dermal layer.
Thicker skin.
So
How mean they? No lah, how fair. So a few more questions I'd like to ask you, doctor. Now,
sure.
if I just want to check with you for skin aging. Now, I noticed that the Caucasian ladies are the prettiest when they are on a 14 to 16 years old. And after that, they tend to age very, very fast. This doesn't seem to happen to Asian. So Asia only starts to age after the age of 30 normally. Why? Why is that the Caucasians age so early?
So as for Caucasian, they have a lighter skin tone, I would say. So lightly pigmented skin, usually they have a small aggregated melanosome, which will reduce the melanin productions. So decreasing of epidermal melanin compound actually causing the skin develop aging sign much more earlier. Plus also the culture of liking sunbathing, their culture habit, drinking, smoking, all these actually contributed to speed up the skin aging as well.
So basically it is genetic plus the lifestyle. So Asian
Yes,
ladies don't really drink, don't really smoke, quite quiet at home.
Not really. Asian, I would say we have a thicker dermal layer.
Thicker skin.
So
How mean they? No lah, how fair.
no, we do have a thicker dermal layer compared to lightly pigmented skin people. So when we age, our wrinkles formation might not as be fast as the Caucasians.
Okay, no wonder. So tell us about Botox. Do you do Botox?
I personally don't do, but I perform, yes.
Very good question. So is Botox safe or not, basically?
Okay, botulinum toxin actually is how to say the function is to paralyze the certain muscle, so it don't move anymore, and when you don't have movement, the wrinkles will become nicer and flatter. Okay.
Right.
Yes. So basically, who suitable for doing Botox? Those have wrinkles, or those are not satisfied with their crow's feet, glabellar lines, or sometimes I do have a lot of that refer over for Brooks, which is the teeth clenching. Yeah, those people they will need some Botox to relax the muscle.
Now, I understand from a few colleagues of mine, don't want to mention name, but their face is a bit plasticky. They are 45, 50 years old, or 55. You look at them, you know, this lady went through multiple surgery. But on a certain day, they come in very young one, you know. Then after a few months, you know the thing come back, you know, the wrinkle. And then after that, you come back, very young already, Suddenly
You sure
young
it's
like
not your
20 years.
eyesight?
Huh?
You sure it's not your eyesight?
Yeah, confirm not my eyesight. Now, my thing is
Okay.
this. We had this thing that we thought her plasticky face it is due to Botox. Is it true?
I did not see your friend, I might not know, but overdoing it might cause a frozen feature, I would say. Yes.
So,
Yeah.
if you
So
overdo it,
basically, yeah, if you overdo it.
so what is your
basically,
recommendation? How many times a
usually-
year?
we will assess the muscle because everyone has a different muscle activity. So it really depends on your doctors to assess it. If they think it's okay, then they will suggest you to top up. Yeah.
Okay, basically it's to see the doctor, right? And don't do it yourself at home.
You can't do it at home. You better don't do it at home.
Yeah.
Because
I have
injection,
a,
yeah,
I have a doctor wife also. I won't ask her to do it at home.
because injection into the wrong muscle or the spreading of the products over the injection site might give you a bit of unwanted result, I would say, unintended paralyzing of the wrong muscles. So you might ended up in asymmetrical phase, yeah, and all these things.
So how important is actually seeing an aesthetic doctor to get your face done properly is this. My wife is a doctor. She sees Dr. Su Senn also. Let's just put it this way, right? She doesn't administer her own face and she went and see a professional that does it, right? So anyway, my wife is a different type of doctor. She's a pathologist, so
Yes. So basically, it really depends on the doctor's assessment and skills.
Dr. Su Senn, I understand that you have partners in your clinic. You handle aesthetic, and you have Dr. Low who handles dermatology. So dermatology means skin diseases lah. So what is that full-fledged kind of dermatology clinic that is run by Dr. Low? Tell us more about that.
So basically, Dr. Low is our in-house dermatologist. So he will be here seeing a lot of psoriasis cases, eczema cases, and all other skin diseases. And sometimes he'll perform some dermatosurgical cases as well. Like maybe it's a malignancy or what, then he will do a biopsy and send over.
So basically, Dr. Low does a lot of derm work, like surgical work, derm work, basically like psoriasis, skin problem, and all that, eczema.
Yes, because nowadays we have a lot of eczema patients.
Yes.
Either they will come over, I will see, or Dr. Low will see. Yeah, it's due to our hand washing with all the sanitizer, all the chemical triggers.
Yes.
Yeah, we do have a spike of eczema patient come over lately.
So basically, it's a full-fledged clean clinic, aesthetic medicine plus dermatologist, live clinic. So, guys, all the audience out there, if you have a skin problem, if you live around Bukit Jalil or Puchong, or somewhere in between Sedang, Balakong, the whole area, OUG, Happy Garden, if you need to see a good dermatologist and to make yourself pretty, I think you can go and visit Live Clinic. My personal experience is not that they are paying me to do this show. Nobody pays me to do it on my show. My personal experience with them, I'm actually quite happy. I think your staff are very well trained. All four of the staffs are very well trained. They take care of us very well. You know, they keep giving us tea, coffee, and biscuit until we say enough. But we are quite happy to receive coffee, tea, and biscuits. But anyway, it was a pleasant experience. So for the last question for the show, Dr. Su Senn, what motivates you and what makes you happy doing aesthetic medicine?
Other than me myself turning more younger skin or more healthy skin, I would say, because I was an eczema patient last time. So other than that, what makes me happy is actually seeing my patients' transformation. Yeah, you can see that transformation from outside in. I cannot do inside out, so I can do outside in. So once they are satisfied with their appearance, they are much more happy. Once you receive a lot of compliments, you feel much more happy. Actually, it changes mentality a lot. So I can see my client actually from a very gloomy look become very happy look. Now she's very excited to see me every month to have go through a skin maintenance program or some enhancement program. She is excited every time to see me.
I am
Actually,
scheduled. Yeah, she's
that
excited to come and
that-
see you.
That's pushed me more to keep on going, I would say.
Fantastic. That is the heart of a doctor who wants to give the best to your patient and make their life better, right? At the end of the day, you know, both of us, me and you, do the same thing. You know, we always tell our clients, my clients, well, I'm in insurance. I always tell my clients, if you have a problem, don't worry about money. Let me worry about money. I'll take care of all the money problem for you. You would take the money that we pay, the insurance company, and take care of the patient, right? So we work hand in hand, right?
Yes.
But unfortunately, aesthetic is not claimable under insurance yet. But certain things I think okay lah, you know, like dermatologist is fine. Disease, cuts, I've been doing a lot of abscess work, psoriasis that needs treatments and all that. We've been making a good number of claims for that. That is fine, you know. So I think the insurance industry and the medical industry complement each other very well to give proper treatment and improve people's life, right?